A 68-year-old woman named Margaret is standing in her kitchen making coffee. No warning. No pain. Suddenly, the cup slips from her hand. Her left arm won't respond. She tries to call for help, but her words come out slurred. One side of her face begins to droop. She's having a stroke. But here's the part most people never hear. What you do in the first few minutes can change everything. Not by replacing medical care, not by fixing the stroke, but by recognizing it fast and acting immediately. Because during a stroke, every minute matters. And today, you'll learn the early warning signs people ignore, what to do right away, and the safe, medically recommended actions that can protect your brain while help is on the way. Part 1. What's actually happening? A stroke happens when blood flow to part of the brain is interrupted. That can be a blockage, most common, or a bleed in the brain. Without oxygen, brain cells begin to die within minutes. But here's what many people don't realize. It doesn't always start dramatically. Sometimes it begins with subtle signs. A weak arm, slurred words, sudden confusion, brief vision changes. These can even disappear quickly. That's called a TIA, transient ischemic attack, TIA. A warning sign, not a harmless event. Part 2. The signs you must never ignore. Doctors use a simple rule: FACE-T. F to face drooping. Arm weakness. S, speech difficulty. T, time to call emergency services immediately. Other signs include sudden dizziness, loss of balance, severe headache with no clear cause. Even if symptoms last only a minute, it's still an emergency. Part 3. What you should do immediately. This is where accuracy matters most. If you or someone else shows stroke symptoms, call emergency services immediately. Do not wait. Do not try to sleep it off. Do not drive yourself. Then, sit or lie down safely, stay calm, loosen tight clothing. Note the time symptoms started. If you're with someone, keep them awake. Do not give food or drink. Stay with them until help arrives. Important: what not to do. There's a lot of misinformation online. Let's be clear. Changing body position does not stop a stroke. Breathing techniques do not restore blocked blood flow. There is no home method that replaces emergency treatment. Medical care, like clot-busting drugs, must happen quickly. That's what saves brain tissue. Part 4. Why staying calm still matters. While breathing techniques won't treat a stroke, staying calm can help. Prevent panic. Keep breathing steady. Help you communicate clearly. Simple, slow breathing can support comfort, but it's not a treatment. There's Part 5. Recovery brain resilience. Here's the hopeful part. The brain has an incredible ability called neuroplasticity. That means it can adapt and rebuild pathways after injury. Recovery depends on early treatment, rehabilitation, consistent movement and therapy. Many people regain speech, movement, independence, but timing is everything. We're Part 6. Prevention that actually works. The best protection happens before a stroke ever occurs. Science-backed habits include managing blood pressure, staying physically active, eating a balanced diet like Mediterranean style, controlling blood sugar, not smoking, getting quality sleep. Even simple daily movement helps keep blood flowing to the brain. Part 7. The real lesson. Margaret didn't save herself with a trick or technique. What made the difference? Recognizing something was wrong, getting help immediately. That's what protects the brain, not waiting, not guessing, not hoping it passes. So, remember this. If you see stroke symptoms, act fast. Call emergency services immediately. That one decision can mean full recovery or lifelong disability. If this video helped you, share it with someone you care about, because knowing what to do in those first minutes could save a life.